The well.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is getting a lot of attention lately because of the results he's getting with his patients. So if you are missing one tooth or all of your teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Mike Golpa. Dr. Golpa.
Hi, Randy.
Welcome to the program.
Thank you for inviting me.
Before we get into today's topic, because I mean, you've developed a big name in Las Vegas. A lot of your advertising with cosmetic. Now you're transitioning, I guess, more into dental implants, or you've always done dental implants?
Well, I always done dental implant. It was both cosmetic and dental implants, so it's a combination of both.
So you've done a lot of kind of cool, kind of hip advertising, and now you're getting more involved in dental implants, or have you always been?
I've always done dental implants. You know, it was a combination of cosmetic and dental implants. You know, we're just trying to get the word out there that, you know, we are doing dental implants as well, and so for people who needs dental implant, you know, they could come to us.
Okay. Now, before we get into today's topic, tell us about your practice. I mean, what all do you do there? Well,
mostly we do full mouth reconstruction, cosmetic, and dental implants.
What is full mouth reconstruction?
Well, full mouth reconstruction is when the whole mouth is all the teeth are breaking down, and and it's a mess, you know, and we need to restore the tooth, we need to extract some teeth and replace implant and so forth.
Now, your office does not look like a dental office. In fact, I've visited dental offices nationwide. Probably by far the best I've seen.
I didn't want to make it like a dental office. I wanted to make it so when the patient comes in, they would be happy, they would be calm, relaxed, you know, and
It's like a living room when you walk in.
Yes, sort of, right.
A big, you said sort of, in fact, I asked you, and you said, I was thinking about living here at one point.
I was thinking about living there, you know, I was trying to make it so, you know, in case I want to stay there some night, it would be nice enough for me to stay, so.
Now, your staff, a lot of pride in your staff, you say?
Yes, they've been with me for a long time, so, and they know exactly how to treat the patient.
So with all areas of dentistry, why the focus on dental implants for you?
Well, Randy, they're the happiest group of patients. You know, when you replace a missing tooth that the patient's been living without for the longest time, they're so happy. You know, you change people's life.
So who is the typical dental implant patient that you see?
Anyone that's missing a tooth. Anybody from a teenager to all the way to a 92-year-old.
Now, why would a 92-year-old want to get dental implants?
They want to be able to chew better. They want to be able to talk without having to worry about their denture coming out loose, or laugh without worrying about it.
Isn't that a bit old when I say for the procedure, for a surgical procedure? I mean, do they fall out?
No.
Really?
No. These implants these days are just, you know, in the old days we used to wait like 6 months before we could place a crown or attach the denture to the implant. Okay. These days are not like that.
Yeah, you say now, I have an ad of yours that says, no more dentures. Get a set of fixed teeth in one appointment. Teeth in one day. Is that right?
That's right. That's what I'm so excited to talk to you about, because this revolutionary technique has changed so many people's life. They can have teeth in one single appointment.
In one appointment. They have to be the right candidate, obviously.
98% of the people are the right candidate for it.
Take me through that process. I mean, somebody goes in, they're a denture wearer, they're watching this, and they want to say, okay, I want to see if I'm a candidate for this procedure.
A lot of patients, they self-diagnose themselves. They think, you know, they don't have enough bone, or they're not the candidate because they've been wearing this denture for such a long time. And everybody is a candidate for this procedure. The position of these implants have changed, therefore it allows us to place the implant without doing any type of a sinus lift or bone grafting, and with the new imaging system we could do the procedure before the procedure, so we don't have to open a flap, there's no suture placed.
So imaging has changed the way?
The new imaging system with the new imaging software that is out there, it's available to us now. We could go ahead and do all the plannings in advance and have the prosthetic, which is the teeth, to be made before we do the procedure, because we know exactly where we're going to place those implants.
Okay.
And according to the study, we could go ahead and make the prosthesis.
The cap that goes on.
The cap that goes on.
What do you call it, by the way?
Well, we call
crown?
We could call it bridge. You know, we could call it a fixed bridge that actually attaches to the implants. And that's what's so marvelous about this whole system, that we can do everything before even the patient gets there.
Now, we talked on the phone. You say how it's normally done, and make sure I have this right, is they go to one doctor, does a surgery, places the implant in the bone. Then they heal for a little while. Then they go to another doctor, usually, and that doctor puts the cap or the crown on top.
Yeah, usually that's how it's done.
Okay.
Usually, you know.
I mean, nationwide, is that how it's done?
That's how it's done.
Okay. You do both?
Yes.
Okay.
I do both.
What's the advantage? I mean, it seems like an obvious advantage.
Well, it's just basically we know exactly where we want to go. We're taking patient from A to Z. So, you know, we place the implant, we know exactly where we want to place it. And if it's a single tooth is missing or more than single tooth is missing, we know exactly where the tooth's going to go. So we place the implant accordingly. And there is no miscommunication between the oral surgeon or the periodontist with the restorative doctor.
Okay.
So everything gets done under the same roof, and we don't have to wait so long.
So the same day, help me understand. Okay, so
we place 4 implants in. Like
this is for a denture wear.
This is for a denture wear. If somebody is missing all their teeth, or if they have compromised teeth that's got to be extracted, we will go ahead and take the teeth that needs to be extracted. We'll take them out. We will place 4 implants, and right after we place the 4 implants, we already have the bridge made. We go ahead and I do have a model which I could show you.
Let me take a look at this. Okay,
yeah,
so
sure.
This is a lower jaw, or is this upper?
This is the upper jaw.
Okay, upper jaw.
So the implants are placed, and the bridge has already been pre-made.
Is that fixed? I mean, that stays in their mouth?
That is fixed.
Does not come out?
It does not come out. And
now, you say this was not available, like, you know, 3 years ago. Or
no,
you didn't know
wasn't.
About this?
This was not available. 4 years ago, this was not available. And there's not too many practitioners or oral surgeons who are trained to do this.
I asked a friend of mine, by the way, periodontists. And periodontists, by the way, great people, and I want to make sure that this is not taken out of context, because I've asked more than one. But one of them said, I don't think you could do it with 4. You need 6 or 8. What is your response to that?
Well, the beauty of these implants, there are different type of implants. They're much longer, and therefore we can apply more force to them. They're 4 times as stronger as a regular implant.
But the critics can say to me, and they said to me, you know, in researching this, Randy, 4 is not stable enough. So what is your response to that?
It's definitely stable.
It is?
It is.
And it's because why?
Position of the implant, you can apply more force on the implant because of the position of it. And the beauty of it is we don't even get involved into the sinus, and there's no bone grafting. So whenever you do a bone grafting, then there is a longer period of waiting and healing and all that. So, and this is what has changed so many people's life. I mean, patient can walk in there and get their teeth in the same appointment.
You said dentures may someday be a thing of the past. I mean, you believe that?
Oh yeah, definitely.
Not an exaggeration.
No, it will definitely
if it's as good
happen.
as you say it is, and I asked you that at your office, why isn't everybody doing it? I'm not clear on that.
Because a lot of people are not educated about you know, their options. This is definitely a brand new option which is available for every patient who is wearing a denture or who is about to lose their teeth.
So take a look.
So
find out if you're a candidate. Do you meet these consults? They come in?
Yeah, they come in. I do the consult with them. They can go on our website. They can, you know, there's patient education tapes that we got that they can watch.
How many people in Vegas you think are wearing dentures?
Well, I know nationwide is 38 million, but
so in Vegas, I mean, 500,000 people, 500,000 people
least, yeah.
wearing dentures,
Yeah.
and you're convinced that if they knew about this, they would all do it.
If they knew about this, right, they would all do
Now,
it.
my
Because
mother,
a lot of people, a lot of patients, they think they need, like, they're missing 12 teeth on top. They think they're going to need 12 implants or 8 implants.
they count their teeth and say
They count their teeth. With this procedure, you only need like 4 implants, and you get their teeth on the same day, and that's phenomenal.
Now, my mother, and we're filming here at our Carlsbad studio in San Diego, she lives in Pahrump, and she says, Randy, and she's 73. She says, Randy, I don't care what you say. She doesn't believe me, because I was telling her what you said. And she's 73, been in dentures since she was 28, and she said that she was told by her medical doctor, I've told you this, that she's not a candidate, that she cannot get, does not have enough bone for dental implants.
You know, you should bring her to my office.
Well, she doesn't believe it. She goes, well, why would he tell me that? You think that even with medical doctors, because they will watch this show, that they may think that it's not possible to get?
Yeah, there's still dentists out there or periodontists, you know, like your friend that doesn't believe that it's going to work, but it does work.
Are you surprised, by the way, sometimes with the outcomes? I mean, when you first started doing this?
I am just excited about what I can do for a patient and how much it can change their lives, how much they can, you know, increase their self-esteem, you know, because these are the patients that been wearing denture for such a long time. Now they can feel the roof of their mouth, they can taste better, they taste the food better, they can chew better, and it's just changing their whole entire life.
So you really think that, I mean, you're changing people's lives?
Oh yeah, definitely. I mean, look at this patient. This is a patient came to my office and he wanted to get all his teeth fixed. He wanted to.
I mean, this cannot be common.
Oh my God, there's so many people that are walking around like this, but they're just not smiling, you know?
What was his options? This is a guy, is that right?
Yes, this was a guy that, you know, wanted to have fixed teeth. He didn't want to have dentures. And there's a lot of patients like that out there, and they're holding on to their teeth because the fact of having something removable in their mouth, you know, taking it in and out, it's just embarrassing to them. So, you know, there is periodontal disease, there is bad breath, and these are the people who have wives. They don't want to kiss their wives because of their bad breath.
Now, how does this even happen? I mean, I guess that's a big question, but how does that clear up, I guess, is my question.
Basically, by extracting the teeth, the periodontal disease will go away, and we will place implants. Now, on this patient, we went ahead and placed like 8 implants on tops and extracted the one that needs to be extracted.
Huge difference, by the way.
Yeah, and we did the same thing on the bottom. He got like 8 implants on the bottoms, and we restore all the bottom teeth.
What does a guy like that say to you? I mean, when it's all done?
Oh my God, he wish he would have done it a long time ago. He wish he would have done it like 5-6 years ago, because he's been walking around with pain and agony. He would rather take the pain and not having a denture.
But why does a person like that wait so long to do something about it?
Well, people are afraid of pain, you know. They don't want to go to the dentist. They don't like to go to the dentist. And
did he say it was painful?
No, because first of all, he was all, you know, sedated.
Okay.
So we make sure the patient is always comfortable, and we extracted the teeth, placed the implant. Implant does not create any pain because in bone there is no nerve. On the upper jaw there is no nerve. So when the implant goes in, there is hardly any pain. Patient, especially this patient, have not taken any pain medication after I placed the implants.
Okay, now the only thing I don't believe, by the way, that you've said so far, or not even today, but when I met you, was that after placing implants and giving them the crown, that they could bite an apple after the procedure.
After the procedure.
You're going to have to get that on film and send that to us, because that is hard to believe.
We're actually going to have one surgery that's going to be filmed pretty soon.
And they bite an apple.
We're going to have the patient to bite on an apple right after the surgery.
Okay, so you put it in the bone and it becomes the bone, but doesn't the bone have to heal around it? I mean, doesn't it have to grab onto it?
We place the implant in the bone, and it's got enough anchorage. There's enough anchorage on the implant that can hold up to the bridge, and the patient can chew the same day.
The patient must also feel worried about biting into an apple.
Right. They're all concerned because they didn't. Yeah, because they had either dentures all their lives or most of their lives, or they had teeth that were so loose and, you know, decayed or broken down that they didn't want to chew anything hard. So it's changing lives, especially this whole procedure.
So the denture wear benefits the most.
The denture wear and the patients who, you know, are perhaps teeth have been compromised so bad that they have to be extracted.
What about somebody that says, and I know somebody like this, that they say, well, I have bad gums. I can't get dental implants because my gums are no good.
That's not true. One thing is bad gums comes from periodontal disease. Periodontal disease comes from the existing teeth that are in their mouth, and due to the lack of oral hygiene, they have gum disease.
And it goes away.
And, you know, by extracting the teeth, you know, making sure that there's no more plaque and there's no more plaque there when the teeth are gone, So the periodontal disease will go away.
What about your training? I mean, what kind of formal training have you had when it comes to dental implants?
Oh gosh, there's courses after courses. You know, it's a learning curve. You know, you know, I started this 10 years ago, and you know, I'm so much better now than when I was 10 years ago, as far as dental implants and you know, this new system that's out there.
You call it a system. When you're talking about system, you're talking about this all-on-4.
Yeah.
That's okay. 4 implants to secure a lower denture.
4 implants to secure the lower denture or the upper denture.
Okay, we're going to take a quick break. When we come back, more about what you know, what you could do for the single tooth and people that are just missing 3 or 4 teeth and why they should do something about it. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Golpa, and we're discussing what you need to know about dental implants. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. Okay, we've talked a lot about the denture wear. I mean, if somebody's just missing 1 tooth, why is that important that they get a dental implant over traditional dentistry?
Well, dental implant, you know, you will preserve the bone. So, you know, if a patient is missing a single tooth,
okay,
it's better off to place an implant and preserve the bone rather than the old traditional way was to carve down the adjacent tooth and putting a bridge over that. There was, you know, it was a snowball effect.
They carve them down.
They would carve them down. There's chances of, you know, those teeth could become prone to decay because the margins of the crowns, and also you will be losing bone where you're missing the tooth.
You say the mouth begins to collapse. Is that a fair statement?
Yeah, yeah.
So you miss 1 tooth.
You miss 1 tooth. What happens is the teeth start shifting. If you're not, if you don't replace it, the teeth start shifting. Your whole bite will change. So when the bite changes, then there's going to be probably clenching or grinding of the remaining teeth. So the whole thing over years it's going to become a mess.
Okay. People that are missing 4 or 5 teeth in their mouth, what about them?
Well, the option they got is, you know, to place like two implants and to put a bridge over those implants, or to just place single implants and to replace every single missing tooth, which, you know, that would be my ideal option.
What about people missing, you know, 4 or 5 teeth on the side?
These are the patients that we really need to see, you know, because these people are headed for a big problem down the road, you know, as far as if they don't replace the missing quadrant or missing teeth, what's going to happen is the upper teeth is going to start erupting downwards, and there's going to
because of the bone, goes away.
Bone's going to go away, and also the opposing teeth is going to start erupting downwards.
At the break, you said these are the people that need to do something right away.
They need to do something right away because the whole bite is going to change, and it's going to be a mess.
What about expense, though? I mean, obviously people are going with these other options because it's less expensive.
Right. I mean, with all these expenses that patients, you know, spend all the money on the root canals, you know, saving a tooth, placing a post, build up, put a crown on the tooth, you know, they could have had an implant right from the beginning, which is going to last them forever, you know.
Just get their teeth back.
Yeah, get their teeth back.
They don't fall out?
No. No, once they ankylose to the bone, you know, we're going to get bone integration around the implants. You know, 99.9% success rate. So
now you're one of the busiest guys in Vegas when it comes to this.
Trying to stay
I mean, a big
busy,
reputation
yeah. Yes.
for dental implants now. So the age range, though, of your typical patient, is it a 50, 60 plus crowd? What is it?
Age range, it could be anybody that's missing a tooth.
Okay.
As long as, you know, they're 18 and, you know, older. If they're missing a tooth, they're going to be my patient.
Now, going into this, I picture, you know, 60 plus and 60s young, older people. You have pictures of what look like models here that are getting dental implants. Why don't we take a look at those?
Yeah, well, we got patients that she had probably 8 implants on top. And you know,
that's a beautiful smile.
Yeah, well, the thing is, patients these days, they're expecting best cosmetic result. They're demanding. They have to be demanding.
Okay.
And so is she. You know, she's missing one single implant, and you can't tell which one is the implant.
Even if it's in the front.
Even if it's in the front,
match it up.
We match it up exactly. You know, as far as the translucency, you know, the lobing, the shade, the shape.
Is there art to this, by the way? Is there art to doing dental implants?
It is an art. I mean,
it seems straightforward. You just put in the implant.
We place the implant. The beauty of this, the Noble BioCare implant, is we could go ahead and get what we call a porcelain abutment, which screws onto the implant, which basically it's the most aesthetic way of restoring a missing tooth. And once we place the crown on the implants, it's going to match perfectly to the remaining teeth.
Now we're just about out of time, but moving to the process. So a patient knows what to expect. Okay, so they go in, they're wearing a denture. What happens on day one? I mean, what are the frequently asked questions on that consult that you get?
Well, on day one, I just basically, you know, listen to them to see what are their needs are, and basically mostly they're concerned about how these teeth's going to look.
Oh, really?
Which is, you know, cosmetically they have to be demanding, and it's also as far as function, if they be able to chew right away, and if there's going to be any pain involved.
You say they don't complain about pain.
There's no pain. There's hardly any pain. You know, there are patients that I give them prescription for pain medication. They hardly take any of them.
So the number one is fear, then, I guess.
Number one is fear, and then, you know, how the teeth's going to look, and also the cost, how much it's going to cost them.
Okay.
Well, good thing about this whole procedure is there's only 4 implants. Versus 8 or 6 or 10 implants.
So what drove up the cost? And I apologize for interrupting, but what drove up the cost in the old days, was it like a bone graft or a lot of surgery involved?
There was,
and now that's gone.
Right, exactly. With this procedure, there is hardly any bone graft. 98% of the patients, they don't need any bone grafting. There is no sinus lift. There is no healing period that's needed.
Now this is based on your own survey of your own patients. Okay, is that right?
This is basically upon this whole system allows us to place the teeth without any healing time. There is no healing time.
Okay, because again, it sounds, you know, this program, and by the way, people need to know this is, you know, you're not reading a script. You didn't pay to be on this show today, and that, you know, it's a real interview. It's your truth as you see it, but, you know, and without putting disclaimers all over the show, results may vary. Are you saying that for the most part, based on the patients you've seen, pain is not an issue?
Pain is not an issue.
And there's no downtime?
There is no downtime, and patients can go in and enjoy their lives right after they leave my office.
No more dentures. Get a set of fixed teeth in one appointment. Where are you going to put this? Where will this be?
Well, we are having this actually published in most of the Las Vegas health magazines and in all the Vegas magazines.
I told you. I said they've got to put your picture in here because you're a handsome guy, right?
If you say so, thanks.
Okay,
I'll take your input.
so the appointment, so from the time they go in, and okay, so on day one of the appointment, how soon before they get the CT scan, and do they know, okay, I'm a candidate?
We get the CT. Once I look at the CT, we can schedule them for the procedure. And the day that they come in for the procedure, we will place 4 implants, and they can lose their denture.
Lose their denture. No more dentures.
No more denture on that day, yes.
Okay, and so from beginning to end, if somebody goes in there today, they can have, in a great
somebody
scenario,
comes in today and, you know, we will do the consultation, take an impression, send them for the CT.
Okay.
Once I look at the CT, we can schedule them for the procedure.
So could that be a 3-week gap, 2 weeks?
Could be.
In a perfect situation?
A week.
1 week.
1 week.
So whoever's watching this with denture.
1
week from
once
now.
they come and see me, a week from now they can
next
lose
Monday,
their denture. Yeah.
they're
going to have a fixed set of teeth.
And it really is that easy.
It doesn't come out. They can, you know, if it's for the upper one, they can fill the roof of their mouth. They can taste the food better. They can.
You say people are pretty ashamed of their dentures. They hide it from the loved ones when they're dating, things like that.
They do. I mean, there's a lot of people who have actually, you know, every time they sneeze or they laugh, their denture wants to come out. I mean, you know how embarrassing that is? It's like, I mean, they live with it. They live with it for a long time. So
you said if there was a try-in period, like you could do a trial run, that the denture wearer couldn't go back.
They couldn't go back. Because what's going to happen with this procedure especially, you will gain 80 to 90% of your chewing function back.
Okay.
Versus a regular denture, which is only 10 to 20% you will be able to chew.
They start eating regular foods again.
Yeah, exactly, comparing to a normal, you know, teeth. So
do people say that? I mean, once the procedure's done, they call you and say, Dr. Golpa, I'm eating this or that. I mean, do you hear stories about?
I had a patient who called, you know, that same night they had steak. They just wanted to have steak
the night of the procedure.
The night of the procedure.
Maybe you should be telling them to take it easy, right?
I should.
Let it heal. It's making me nervous thinking you do the procedure and just.
Yeah. Well, they should have invited me to the steakhouse.
Okay, we're going to do a Dr. Golpa challenge. That's what I want to schedule, where you do the procedure and then they bite it into an apple.
Okay.
Would you do that?
Yes.
Okay, we'll have to get the cameras out there and do that. Final message. Oh, and by the way, this is something I want to bring up. It's in my notes. 2 implants can also do a snap-in, snap-out lower denture. Is that true?
2 implants can do a snap-in, snap-out, you know, but it's not my ideal treatment because they're still having a removable appliance that they have to take in and out.
Okay.
It is more secure than a regular denture without any implant, but you know, it's something removable.
It's a little less expensive, but you don't like it.
It's a little bit less expensive, but I don't like it because it's still removable.
What about mini dental implants? And we are out of time, but mini dental implants
doesn't work at all because I think it's basically for a 3-month trial period.
So it's a gimmick, in your opinion?
It's for a temporary. I would just use it maybe for a temporary crown.
So you would never give a loved one mini implant? Because I see a lot of ads for
I have never done any mini implants because I don't believe in them.
They're just too small?
They're too small. There's a lot of failure rates with them, so they could fail.
All right. Final message, somebody watching this, they're missing a tooth.
They should come into my practice for a consultation.
Okay, good.
So,
well, I want to thank you for coming to the show. Very interesting.
Thank you so much, Randy.
Very good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.